Thanks very much for the opportunity to talk with you today. As previous speakers have mentioned, there's a great interest in e-services, particularly over the last 5 years or so, as a means of developing mass delivery information and help for people with mental health problems. And it's thought that by providing things online and through other e-technologies, we can basically get a lot of information and help out to people in a very accessible way that allows people to remain autonomous and keep their privacy. And also that we know that a lot of people with mental health issues are already online looking for information. So, for example, for people with anxiety and depression, they're more likely to be online looking for information and help than people with other sorts of physical illnesses which are very stigmatised, such as incontinence and genital herpes. So it's a really strong presence out there. And also, as some of the other speakers have spoken of, it's thought that by being able to do things online at your own pace, that perhaps that helps overcome some of the shame and stigma that may put people off getting help. So even as a first step, it's very accessible. There's also increasing evidence that these interventions can be effective and quite cost effective, particularly for large groups of people. eHub services really focuses on trying to empower consumers to understand their conditions, the choices available to them, and to be making their own treatment decisions. So we have 3 areas of focus. One is mental health information. The second one is automated self-help tools. I think Dan referred to those sorts of things as self-directed therapies. We don't have clinician backup. We are self-help focused. And then we also do provide online peer support. So we have an online peer support forum. Our programs are all funded through the Department of Health and Ageing, so they're free and anybody from anywhere can use them. At the moment, we have 2 current projects that we're developing in the area of alcohol and other drug use. We've been joined by 2 researchers in this area, Dr. Robert Tate and Rebecca McKetton. And in collaboration with Francis, we're currently working on an intervention for stimulant users. So what's happening with that, it's going to involve motivational interviewing and CBT, and it's basically getting best clinical face-to-face practice and putting it into an online format. So there's going to be 3 modules for that. And we're just beginning the testing for that so that they're going to be recruiting in October for the trial. We're also developing a binge drinking intervention for underage drinkers. And currently they're running focus groups both online and face-to-face to try and understand some of the factors that may influence young people to drink or not drink. And a brief intervention will be developed. There's a number of other projects that are in conception at various stages, but those are the 2 at the moment. The other services that we have are primarily aimed at anxiety and depression. They may be of use to you as workers, so I'm going to just sort of take you through those. So, as has been mentioned before, and as I'm sure you know from your everyday work, people with substance use problems have a much higher frequency of mental health problems, particularly anxiety and depression, and particularly people who are in treatment. So at eHub, we currently offer 5 programs which are just available to the public. Blue Pages provides information about depression, and it talks about what it feels like to have depression. There's screeners, there's some downloadable relaxation audios, that kind of thing. And if you click on the list of treatments, it covers a whole range of different treatments ranging from antidepressants to chocolate to cognitive behaviour therapy. And researchers review the evidence base for each type of treatment. And the smileys relate to how much evidence is available. And if you click on any of those, you get a description of the intervention, where you get it, and the kind of evidence that's available. Mood Gym is perhaps the grand old lady of online interventions. It's been going since 2001. It was initially designed as a prevention program for young people and depression. So it's a bit cheesy in how it presents things, but some people are very, very attached to it. It's got 5 modules, so it's CBT, and there's around 20 studies either ongoing or that have been done on MoodGym, ranging from clinical populations to prevention populations and all around the world. It's currently available in Norwegian, but there's a whole lot of other translations that are in progress. The basic premise of MoodGym is there's some characters. So this is Elle, who's gorgeous, talented and wonderful, but feels like she's a fraud, and at any time people are going to find out. So each of the characters represent a different type of thinking, and people follow the characters through different scenarios so that they can better identify different thinking patterns and learn how to challenge the ones that are perhaps not so helpful. MoodGym, by 2008, had basically been logged in from all over the world. So the white countries there are the ones where people hadn't logged in from, as far as we could tell. And it's currently got over 400,000 registered users. I just want to quickly take you through one set of data that's being analysed currently. So in this study, callers to Lifeline were recruited into this study, and they either received an attention control, or they received follow-up phone calls from Lifeline counsellors, or MoodGym, or a mixture of MoodGym and the follow-up calls. And this is a measure of depression symptoms. And so what we found was a significant improvement in depression symptoms from the beginning to the end of the intervention, and that for the 2 conditions where MoodGym was involved, that continued to improve, as you can see, over the next 6 to 12 months. And as similarly to some of the things that David was talking about, there wasn't a hugely significant difference between having the additional therapist support. Interestingly, in that study, levels of drinking also reduced, although these people didn't have a primary drinking problem. And what's also interesting is MoodGym doesn't talk about drinking, it's just general CBT for depression. So there was some effect there. And this is our latest one. This has been described as MoodGym on steroids. So eHub, basically we're going to keep adding, continually adding modules as we develop them. At the moment there's depression, anxiety and worry, generalised anxiety, social anxiety, bereavement and loss, and divorce and separation. So currently parts of eCouch are being evaluated, and there's 6 studies happening at the moment. As well as having a bigger range of symptom areas that it covers, eCouch is also able to offer different sorts of strategies. So for example, in this one with depression you get CBT, but you also get interpersonal therapy as well. The basic format of eCouch is you do register, you do some quizzes, you then get some psychoeducation in the area that you're interested in, and then you go into the toolkits. So this is the one for general anxiety. So people have a choice of 3. They can click on any of those. And then once they go into the CBT, they then have different choices. They can navigate and choose which one they'd like to do. In the social anxiety one, people are asked to do the exposure practice first. And I find it quite interesting for a computer program that's self-help. It does take people through an exposure routine. So they first of all learn how to calibrate their emotions, to set some goals in a hierarchical manner, perhaps do some exposure in imagination, a role play, and then go through to doing it in real life. Beacon is another program that we have, which is, you don't need to register for this. And what Beacon does is look at internet self-help programs from around the world, and gives a little description of each program, and again rates the evidence that's been published to support the effectiveness of that program. So as you can see, there's a whole range of physical as well as mental health issues. There's also alcohol and substance abuse. So if you clicked on depression, you get a list of programs, a little description of each one. You get an overview of the evidence and citations, as well as the ratings. We've also invited consumer contributions for the ratings as well. Finally, something that I'm particularly excited about is Blueboard. This is an online forum which is for people with a range of mental health issues. We do get people talking about particularly alcohol, but also some other substance use, often prescription use, though they tend to be people whose primary problem is anxiety or depression. So what happens here is people just exchange information about their situation and things that they find helpful, and they support each other. It's very tightly moderated. We have consumers that we employ to moderate, and I supervise them. And we're very strict about not allowing anything to do with suicide or privacy information on the board. Current themes, I find it really fascinating on the board how people talk to each other, but also consumers and carers talk to each other as well. So often they can say things to each other that they may not be able to say to people in real life. So people talk about their need for self-care as a carer. So very often consumers will plead with carers to take care of themselves and not get burnt out and be there for the long term. And so there'll be some discussions around that. The ways that caring can disempower people and how to support people who are not at the point of wanting help at this time. And then also consumers talk about treatments and managing symptoms and, I guess, the comorbidities and ripple effects that come. So I was thinking, how might eHub be used in an alcohol and drug setting? Well, I thought of two things. We haven't tested these in that population, so you need to be aware of that. But I thought that perhaps where people's primary drug and alcohol issue had been dealt with and you thought there was a potential for that person to perhaps develop anxiety and depression, or perhaps has early symptoms, or perhaps who has had treatment and you want a nice, accessible extra resource for relapse prevention, perhaps they may be of use in a self-help manner there. You can also use them as a therapist, perhaps where you've got more complex cases. You can use them as a resource in face-to-face CBT. So in other populations, there's some indication that if you add things like mood gym to face-to-face CBT, it actually makes it more effective, the outcomes can be better. Also, I thought where you've got a situation that's very complex and there's some aspects of that person's treatment that the therapeutic relationship is critical for, that you might want to run alongside a CBT intervention as well. And also, obviously, the peer groups. I mean, there's a little bit of evidence that some people may be able to use these groups to practice social skills and also to get some support, and in some cases maybe even as a substitute for other behaviours. So, for example, in some of the self-harming literature, people might go onto a board and talk about how they're feeling rather than actually harming themselves. So perhaps it would be helpful. Thank you. If you are interested in finding out a bit more about the programs that we offer, please feel free to contact me. We also have a portal for clinicians which talks about all the programs and gives lots of information and ideas about how to use them. You can also order any free promotional material that you may want. We have some little postcards. I've got some samples up there. There's also a range of other things that you can get, and we'll send them out to you if you'd like to give them to your patients. But I'm really looking forward to the discussion later on, and thank you very much.